Hello and welcome to another installment of the Healthy Baby, Healthy Mother Initiative. My name is Dr. Nicole Machac. I'm an OBGYN here at Jamaica Hospital. I'm going to talk to you today a little bit about bleeding in pregnancy. Bleeding in pregnancy is never normal, but can happen for a variety of reasons. In the first trimester, bleeding in pregnancy is commonly due to implantation, when the pregnancy is attaching to the uterus. This is very common, occurring about a quarter of pregnancies. But bleeding in pregnancy can be due to a number of things that are concerning, such as an ectopic pregnancy, which is when the pregnancy implants outside of the uterus. This can be life-threatening and very, very dangerous. It's often accompanied by symptoms of pain, nausea, shoulder pain. So if you're experiencing any of these symptoms and you haven't had an ultrasound yet to establish that the pregnancy is inside the uterus, it is very important that you go to the hospital. Bleeding in early pregnancy can also be due to a miscarriage. Miscarriages are also very common, occurring in about 10% of pregnancies, and it's probably higher. So if you're experiencing a lot of bleeding, soaking, pads every hour, call your doctor and go to the emergency room right away. Bleeding can also happen in the second trimester of pregnancy, most commonly due to inflammation of the cervix or fragility of the cervix after things like an exam or sexual intercourse. It can also be due to problems with the placenta, which is the organ that feeds the baby and connects you to the baby during pregnancy. Sometimes it can be over the cervix, which can be dangerous and can bleed, and also it's possible for the placenta to come off the uterus and start bleeding. These things can also happen in the third trimester too, and these are very dangerous, as it can be a sign that there'll be compromise to you and the baby. Bleeding in pregnancy, in late pregnancy, can also be a sign of preterm labor. So these are often accompanied by lower abdominal pain, back pain, diarrhea, nausea, and vomiting. So if you're experiencing any of these, it's very important, again, to call your doctor and go to labor and delivery.